some of the people you know and your social circle said it's not important issue, it's fertility, and it's a really minor percentage of the people who suffer fertility. We have overpopulation. Why we care really about fertility? But the numbers, which I am going to say and you are going to confirm, is shocking, because one couple every 4 couples are suffering from infertility in developing countries and in Africa. 85% of these people who suffer infertility, it can be preventable. 85%. They are already caused infertility for untreated infectious diseases, unsafe abortion, or unsafe delivery, or STDs, or whatever causes of infection which is not treated, and then it's too late, and the whole secondary infertility or the infertility being caused. So hence, the campaign is very important because it will raise awareness about prevention, so we can actually eliminate 85% of the cause of the problem. And then for the rest, if we succeeded to have this prevention, they will know that it's not only the woman who's been to blamed for fertility, because 50% of the fertility cases due to male factor. So let us discuss this together too.
Thank you, Rasha. It's very true, because, like, as you heard from my story, if the infection was detected earlier, then such problems would not have arisen. Like blockage of my tubes, that is due to infection that was not treated. Just like the woman who gave her story yesterday.
The doctors need the stable environment, a stable legal and ethical environment in order to carry out fertility work. That does not mean that legal and ethical arguments will not continue to take place in society, because society has got subsystems in which colliding ethical judgments and colliding social values occur. And we must live and let others live as well within that context.
We don't need to create a new infrastructure. We can actually integrate our awareness campaign, posters, information to this program, which is already have a lot of visitors every day. Plus, of course, the social media, which is definitely very important. Media campaigns, and what else we can do? Actually, we can integrate it in the education.
But mine is just to change the structure, the curriculum review. People who are in charge of curriculum, we can also talk to them to make sure like it's integrated in the new curriculum that they're going to change.
In Nigeria, in the commercial capital of Lagos, I'm sure there are probably over 20 IVF centers. In Abuja, the capital, there are probably about 15, and then there are other cities, Enugu, Newi, Port Harcourt, so many. So the problem is not in the number, but we also have some in government, remarkably. We have some in teaching hospitals, we have some in National Hospital where I work, government run and government subsidized. So I also think that what we need is help, capacity building. We also need regulation, and I think maybe this draft bill, probably working through the Regional African Fertility Society, will help us in the regulation of IVF.
My comment though is in the lack of awareness that we have in the populace about areas and matters that affect their health and sexuality. For example, you mentioned about the corn biopsy and cervical cancer, and the doctor has asked whether a simpler method could have been used to diagnose for cervical cancer or to negate the cervical cancer diagnosis. We're passionate about cervical cancer because it's one of the issues that's affecting our women today, and women don't even know the benefits of early detection. So my appeal to you is, as you're championing on infertility in Parliament, can we also have your core members who are also women in Parliament talking about other issues that affect women that also have large magnitude of effects on their families as well, cervical cancer being one of them.
So I think we have so much to do, especially in Africa, on how we think about sex education. What is it that makes us so like it's a sacred thing that we cannot talk about it openly? But you see, when we do that, the young people suffer, because sometimes they want to hear from us. like, we've gone through this, we've had this experience, we don't want you to go through the same. And these are the measures, these are the steps that you can take to make sure that you're safe.